My name's Helen Bagshaw. I work in the intensive care unit at Winona Health. I qualified in Scarborough in Yorkshire in England. I've worked in all sorts of different areas, but I keep coming back to the ICU. I like the one-to-one nursing, and I like being by the bedside.
Helen is deserving of the Caregiver of the Year award because she is one of the nurses that exudes excitement about her profession. She's been a nurse for a number of years, and she still keeps that compassion and that excitement about her profession with her daily. Her passion is not only with hospital nursing, but also how she can develop the community and how she can educate in the community. With her hands-only CPR, she has opened the eyes to many community members about how to do CPR, because many people are very nervous about doing that, and I'm sure she has saved many lives without realizing it because of all the training that she has been doing.
Florence Nightingale, the great English nurse, she had some really great ideas. Something like, unnecessary noise can really be a deterrent for patient care.
Helen led an event to look at ways that we could decrease the noise at our hospital. With her lead on that project, we developed our quiet time process and how that does affect patient care and patient healing. So she's really worked with processes and policies here at Winona Health and has made improvements not only with quiet time for our patients, but also kind of looking at the workflow of the nursing staff to try to see if there's other opportunities that we could put into place that would benefit the patient or even the nursing staff to keep the nurse at the bedside.
I think Helen is such an asset to our unit for so many reasons. As far as our staff, she always makes everyone smile because she comes to work smiling.
It takes a team to get a patient home, so everybody's got their skills, and in ICU, the nurses and doctors that I work with, everybody's got a talent, and we all learn from each other, and every day I go home and I think, gosh, I've been in nursing since 1980, but I've just learned something else.
She's full of energy, she's happy. When they always say that people that say the glass is half empty or half full, she's the epitome of the person that would always say the glass is half full. She also delivers Meals on Wheels on her days off. Her hands-only CPR is all on her own time.
I've often met patients that I've done rounds to deliver meals to that come into ICU, and they know me, but they don't know where they know me from sometimes. And seeing them in the hospital and knowing what their home situation is, that makes me think, I want to get you back there.
Helen is one of the nurses that I think a lot of the nurses in not just the intensive care unit, but also in med-surg peds department, that they really look up to. She exudes excitement when she comes to work. If I could have 20 Helens working in the intensive care unit, I would sign up for that because she's just a wonderful addition to the whole team.
You've got to keep bettering yourself there. I couldn't be that nurse I was in 1983. And you've got to keep learning, and you have to teach your younger nurses and the nurses coming through, because you can teach them everything they need to know from the books, but if you don't know how to talk to somebody and reassure them and care for them, then the medicine and the IVs are not important.
Helen is able to put her patients and their family members at ease by the way she communicates with them. She utilizes medical terminology in a way that they can understand and includes them in their care and conversation. Just by being at the patient's bedside, putting her hand on their arm or on their forehead just to help them understand that she's there for them and she's there with them, and she will do her best to make sure that they're cared for.
I can't think of anybody else besides Helen that could be deserving of this award. She just goes up and beyond anything that anybody that I know of has ever done, and just because she cares so much. There's so much that she does outside of not only in our intensive care, but for the community as well. I mean, she just wants to give back to the community and to their patients and make this a better place.
And that's what people remember. They don't remember that you did the IVs or you did all the medicine. They remember, oh, you made me a coffee, or you talked to me, or you flipped my pillow over, or they don't remember all the you know, oh, I did this and I did that you think are important. They remember, you know, how you made them feel.